Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about coding guidelines for abortion. So in last video already I posted for coding guidelines for delivery. So in fifth series, this is the last section, and definitely for CPC exams, so you will get one question either from delivery part or abortion. So please guys, don't skip this video, please watch until the end. And those who are not subscribed my channel, please subscribe my channel and press bell button, select all, then only you will get my future videos as a notifications. Okay, let's see abortion coding guidelines. Before saying the CPT codes for abortion coding, so let's start from the definition of the abortions. So what is the definition of abortion? So clinical terms for the termination of the pregnancy before the age of the viability, usually before 20 completed weeks of gestation. So provider removes the uterine content surgically. By inducing labor or pregnancy may be expelled spontaneously. So which ends spontaneously, it is called as miscarriage. This is the definition of abortion. So in abortion, we have three types of CPT codes. One is complete abortion, incomplete abortion, and induced abortion. So incomplete abortion CPT code is 59812. The description of the 59812 is treatment of incomplete abortion any trimester. That means any trimester. So whatever trimester, there is no problems. For any trimester, this is only one CPT code for incomplete abortion. Okay. So the definition of incomplete abortion is the passage of much of the pregnancy tissue with some remaining in the uterus. So usually cervix is open and bleeding may be heavy. So fetus has been paused but parts of the placenta remain. This is called as incomplete abortion. So range of specific coding guidelines is, if it is abortion treated by medically of spontaneous complete abortion, any trimester, we need to use only ENM code. We don't have any surgical CPT code. If it is abortion treated by the surgically of spontaneous abortion, the code is 59812. Okay, there are some tips for the incomplete abortion. So if the provider normally perform this procedure in the first trimester or less than 13 weeks and 0 days of gestation. 59812 still correct if the provider removes the product consumption in the second trimester and 14 weeks 0 days less than 28 weeks of gestation. Suppose if the amount of work removed the product consumption after 20 weeks of the gestation, so doctor may use more extensively. If this reason, so we need to append 22 modifier if doctor is mentioning any difficulty of the procedure or the duration of the hours. If we have in the medical reports, then we need to use 22 modifier if the procedure is performed after 20 weeks of gestation. Okay. So the next CPT code is spontaneous abortion. There are two CPT codes. One is 59820 and another one is 59821. So what is the definition of this spontaneous abortion? In this procedure, provider determined that fetus has died in the uterus or in uterus before birth and the gestation age is less than 14 weeks and 0 days. Provider then surgically remove the fetus and all products of conceptions. So this is called as spontaneous abortion. Spontaneous abortions, the word the doctor may use missed abortions. So we have two types of CPT codes for missed abortions. One is 59820 and 59821. This procedure doctor may do only vaginal approach only. Okay. This is the clinical responsibility. So how the doctor will perform this procedure? So I have mentioned in this slide. Please, if you want, you can go through this. Okay, what is the definition of missed abortion? The type of abortions where the embryo or fetus dies in uterus before 22nd completed weeks of gestation but products conceptions remain in the uterus after the death. So this is missed abortions. So that product or any remaining product conceptions doctor will remove surgically. So for this reason only we have to code this CPT, this either these two CPT codes. Okay. So we have two CPT codes. One CPT code is for first trimester, that is 59820, and second CPT code is for second trimester. The CPT code is 59821. There are some tips to remember the CPT codes. Whenever missed abortions comes in your questions, please don't forget to check the ICD 10cm code. So it should match. Missed abortion means missed abortion say ICD code only we have to bill. Okay. Then if new the definitions will be fetus that dies in the uterus before 20 completed weeks of gestation. But currently definition of fetus that is dies in the uterus prior to the 22 completed weeks of gestations. Okay. Then next is the last topic is induced abortion. Induced abortion means therapeutic abortions. What is the definition of induced abortion? Induced abortion means termination of pregnancy brought on intentionally by medical or instrument. This is called as induced abortions. So we have some terms of definitions we used in the procedures, like what is a curettage, amniocentesis, curate, and placenta. These are the terms we will use in this sections. So those who wants to learn the terms first, then you can go through this slide, or you can comment whatever the terms you want to know the definitions. Okay. The definition first, the definition of curettage means the use of curettage to remove the tissue by scraping or scooping. This is called as curettage. So here also I have mentioned the clinical responsibility, how the doctor will perform this procedure. Okay, if you want you can go through this slide. Then in induced abortions we have some set of CPT codes. One is D and C, that is 59840. D and E, dilation of evacuation 59841 with the saline method 59850 and 59851. Then vaginal suppositories, that is 59855, and the final is with hysterotomy method, that is 59100, 59852 and 59857. So first we will see the DNC code. So DNC code, CPT code is 59840. So how doctor will perform this procedure means, so doctor will terminate this pregnancy for elective or therapeutic reasons. Okay. He removes the fetus and products of conceptions by dilation of the cervix and then using the suction curettage. So provider perform this procedures via vaginal approach only. Okay. This procedure is normally done during the first trimester or less than 14 completed weeks of gestation. This is called as 59840. Okay. Next, D and E. D and E means dilation of evacuations. CPT code is 59841. So in this procedure, provider terminate the pregnancy for elective or therapeutic reasons. So he removes the fetus and products of conceptions by dilating the cervix and then evacuating the fetus and products of conceptions using the forceps. So this is called as 59841. So provider perform this procedure via vaginal approach only. So this procedure is normally done during the second trimester. But D and C doctor may done only the first trimester. D and E doctor will do this procedure during the second trimester, from the 14 weeks to less than 28 weeks of gestations. Okay. So what is the meaning of curettage means? The use of curate to remove the tissue by scraping or scooping. What is the curate? Curate means this is a spoon shaped instrument used to scrap these tissues. This is called as curate. Okay. Next we will see the saline method. There are two CPT codes for saline method of abortion, induced abortion. One is 59850 and 59851. So induced abortion by one or more intra-amniotic injection, amniocentesis injection, including hospital administration, visit, delivery of fetus, and circumvenous. So what is the definition of this CPT code? Means in this global procedure, doctor will terminate the pregnancy by injection of the saline solutions into the amniotic sac. So this is leads to fetal demise, which is will usually begins the labor process. So the provider admit the patient first into the hospital, then they will administer that saline into intraamniotic injection and labor that follows the delivery of the fetus and the placenta. So provider then follows this patient in the hospital until discharge. Providers use this method usually after first trimester only or 14 weeks of gestations. Okay. So what is the meaning of amniocentesis? Means the procedure in which a small sample of amniotic fluid is drawn out of the uterus through the needle inserted in the abdomen. This is called as amniocentesis. What is the amniotic sac? A bag of the fluid made inside the uterus where the fetus develops and grows. It is sometimes called as membrane because the sac is made of two membrane. It is called as one is amnion or chorion. Okay. So what is the meaning of placenta? Placenta is a special layer developed during the pregnancy to protect and nourish the fetus. This is called as placenta. Then the final definition is circumvenous, the clinical term for after birth, which consists of the placenta and fetal membranes that are expelled from the uterus after the birth of the fetus. This is called as circumvenous. So there are some tips that is provider no longer usually perform this procedure because the complication of that occurs use of saline solutions and adverse of the drugs that works more effective to induce the labor. So we may use 22 modifier also in this procedure. Okay. Then last is vaginal suppository method. This method CPT code is 59855. So vaginal suppositor doctor may use, this is called laminaria. The suppositor name is laminaria. So this procedure include hospital administration, visit, delivery of fetus and circumstances. Okay, let's see the definition of this CPT code. In this global procedure, provider terminate the pregnancy by inserting the vaginal suppositor to induce a labor contraction and may also insert the laminaria dilated cervix. So provider admit to the hospital, patient will admit to the hospital and insert this drug. So and the cervix dilated the manage the labor that folds and deliver the fetus and placenta. So this is called a 59855 CPT. Okay. So laminaria means small rod made from the seaweed that absorb the moisture or expand inside the cervix to open it. So this is the called as laminaria. That's it about the abortion sections. If you have any doubt, please comment in below comment box, and if you like this video, please like and share to your friends also, and don't forget to subscribe my channel. In next coming videos, I am going to start 6th series. So in 6th series there are limited guidelines only, and afterwards the 7th also limited guidelines. So let's see one by one, and so please follow my channel frequently. So maybe I will post in future 2 weeks once or 3 weeks once only I can able to post one video. So those who are not those who are willing to join as a coding course, so you can mail me. So it is in the description of this comment box and description of this video. So those who wants to learn very fast, those who wants to write immediately exams, so those people can reach out to me to start sections with me. Okay. CPC course. So CPC course, there will be less amount only I am going to take as a fees, and there is a lot of books available like CPT 2000 current editions, PDF format, and ICT EPICS books. Then mocks exams, mocks questions, so a lot of mock questions are there, and the most important one is 2023 coding study guide. It contains 200 questions, and each chapters 10 questions. This books I purchased from APC. Those who wants to get, you can contact me. Okay, so okay guys, that's it about this video. So thank you for watching my video. Thank you so much. Bye bye.